Committee here at 10:12 a.m. And first item of business is call to order, please. Next is the invocation, and I'll ask Councilor Baker to give that, please.
You bow, please. Our gracious Heavenly Father, let us thank you for this day that we can come together and do your work and keep in your eyes and your sight and your loving hand on all those overseas that are in harm's way and our people that are suffering all over the nation with infirmities, and that this health committee can maybe ease their pain and suffering. Bless each person here and give them safe traveling grace on their way home as these meetings conclude. In Jesus' name we pray. Amen.
Amen. Next item of business is roll call.
Bradley Cobb.
Honey.
Janelle Fulbright. Bill Anglin.
Here.
Bill John Baker.
Here.
Jack Baker.
Here.
Carly Buzzard.
Here.
Julia Coates.
Here.
Joe Crittenden.
Here.
Jody Fishinghawk. Meredith Fraley.
Here.
Don Garvin.
Honey.
Tina Glory Jordan. Curtis Snell.
Here.
Christo.
Here.
David Thornton. Kara Cowan Watts.
Honey.
We do have one.
Next item of business is approval of the January 15th minutes. I have a second. I have a first and a second. All those all those in favor of approving the minutes, say aye.
Aye.
Any opposed? Councilor Baker.
Comment. Tina is not here today, and she is doing it for each and every one of you to keep from passing on the flu that she claims she got from me. And I for one would like to applaud her for not being here today.
Next we have committee reports, and first from Claremore Service Unit is Marty Smith. And please stand up. For those of you who don't know, I've always wanted to introduce correctly, and I ask, and Mr. Smith is a pharmacist. So,
Good morning.
now we know.
What I listed first on Claremore are the following the format. Did everyone get a handout? Or if you didn't, let me know. I have a few more of them. One of the accomplishments since the last meeting for Claremore is that they received an award from the Office of Information Technology. It was one of the 3 facilities recognized out of 24 facilities that were considered for the award, and it was related to the utilization of RPMS in patient care related activities and the integration of the processes. Another accomplishment that has occurred since the last meeting was we had a CAP survey, which is a College of American Pathologists come and survey our laboratory. I attended the closeout session by the CAP surveyors, and they noted that our lab had made some significant improvements, and we are okay till our next survey. I'm not sure when that will be because this one was unannounced. They just appeared one day at the facility. Another accomplishment is we have a new C-arm, and that is like I don't know if everyone's familiar with the C-arm. I had to ask Dr. Mobley exactly myself the functionality, but it's like a digital mobile radiology unit that can be used for a lot of things, as he tells me, removing foreign objects in the ER, and that to assist with removing foreign objects in the ER, that type of thing. But the reason I list it as an accomplishment is because anytime you can get anything through UFMS, it's an accomplishment, through purchasing right now. And we've been trying to get that for several months, that piece of equipment. It should help our surgeons and several of our doctors. As far as future plans, I might start with the bottom one first that on my list is, I normally wouldn't list that as a future initiative, but our staffing levels are lower than we would like, and it impacts the number of patients we can see, and it impacts the amount of revenue we can generate. And so we're going to try to make that a fairly high priority over the next few months, as far as, you know, to work with HR and even with procurement, because a lot of people don't think of procurement as affecting retention, but we use a lot of contract or recruitment. We use a lot of contract doctors, and it's real important that we can get them paid for their work, and so we're going to try to emphasize that. We're also upgrading our, we're going to try to get our CAT machine upgraded. The one we have right now is like a single slice CAT machine. It's really slow for CAT scans. It's really slow, and it uses a lot of dye, and there's a lot of reasons to move to a faster one, less dye. You don't, as Dr. Motley says, you don't have to slow the heart to do some of the studies, and we'll be able to do some studies inside the facility that we're currently having to send out, so it'll be good for the patients. And they're kind of like digital cameras. They've come down in price significantly, so we're trying to jump from a single slice to a 64 slice machine. Another thing that we're working on, and I know you've heard this in the past, probably, is the OB department. We have been trying to staff that department for several months now, but we've tried to get a plan that was acceptable for staffing and remodeling, and we've actually are on target to begin the remodeling as early as March the 1st. That would be like our current delivery rooms, and then to create 2 new labor LDRPs, or labor delivery, recovery, and postpartum rooms. And that would be kind of like the concept that where the patient and their family have a delivery room. It's a patient-centered type of delivery versus the mother just going into the delivery room. We surveyed several of the prenatal patients and several of the OB patients to allow them some input as to the color selection for the paint for the rooms and that sort of thing, just so that they would know that we really are trying to get this effort off the ground. We recently hired a new ambulatory care manager, and this person would be working directly. It's Travis Scott. He's from Hastings, actually, registered dietitian, but he has a master's degree in public health. He would be working directly under our clinical director, Dr. Mobley, and be over departments like a lab and pharmacy and our appointment system and that type of thing. We're hoping that it will help improve patient flow through the system, and he has a lot of good ideas, and we're looking forward to him being there. Should be on our staff real soon. Some of the problems we've had in procurement have been related to the conversion to the new financial management system, but in addition to that, we lost 2 real experienced people that retired. And so what we've done to compensate for that is we've brought in a contract person to help work with the requisitions, and we've also advertised we should have another person back there in the support services department, hopefully by the next time I see you. As far as recruitment, Dr. Mobley and Kara and Dr. Steelberg met with the medical residents at the Oklahoma State University Medical Center and tried recruiting a few of them. And at the same time, I went with the team of CHS is always an issue, with just about everyone. And so I met with the CEO to just more of a public relations type of meeting and to help educate him on our process for contract health services. And like I said, I took our director of contract health services with me, and Dr. Mobley was also in the meeting. We mainly just talked about the process. As far as our statistics, as I said, our staffing is, I don't know if I said how much our staffing is down, but we're down, and when I say staffing, I'm talking about doctors, nurse practitioners, and PAs, the ones that are the primary care providers at the facility. We're actually down a little over 30%, and as you can see, our visits for the same time last year are down about 18%, and there is a direct relationship between the number of providers and the number of visits. The good news is, they're all working really hard to keep seeing as many patients as possible, and the other good news is that our revenues, as a result of that, are slightly increased from the same time last year, even though the visits are down. So what that indicates to me is that we're doing a little better job of capturing a visit and documenting visits and billing for visits. And if we can get our staffing level back where we would like it, we should be able to see more patients and improve that situation. And I believe that that's all I have to report, unless someone has questions for me.
Councilor Buzzer.
I got a question.
Yes, sir.
What's our reason for staffing to be as low as it is? Is it none of the doctors or nurse practitioners out there, or is it the money, or the place where they're working, or
Well,
analyze that situation?
if I knew the exact answer, I would
Well, what do you think?
but there's a lot of contributing factors. We were talking about earlier, 2 or 3 of us standing out there, we're competing. There may even be a shortage nationwide. Everywhere we go, we're hearing the same thing from other clinical directors, and we've had some issues with being competitive even with the Veterans Administration, and we've lost some doctors to them. Some of them just, went to better opportunities. We had one internal medicine doctor that went for a fellowship in cardiology, and then the nurse practitioner also went to work for a cardiology group. And then we have the intrinsic problems that are intrinsic to the organization, like the HR. I went to a meeting last week, and that was the number one priority of the other CEOs of hospitals, was the human resource issue that we have, because recently they regionalized the human resources department, and they don't have all the problems lined out with that. And so it's a variety of problems, and so we're going to work on the ones that we can fix locally, like being sure that our positions are advertised timely, and that people that aren't inside the organization can know when there is a vacancy and that type of thing.
Thank you.
That's my best guess.
Thank you.
Okay.
Any more questions? I have I have a statement on the collections. Just my comparison comes from my own practice. I would just be careful. Let me know next quarter on those collections. You're usually about a quarter behind on those collections, so I'd be interested to see next quarter if those collections are still up, because you get about a 2 to 3 month lag on those
Right.
Medicare payments. So anyway, any more questions? Thank you.
Okay.
Next, from Hastings, Ed McLemore.
Good morning, Mr. Chairman, members of the committee. You have my report. To point to a few highlights. Last month we had a good month in terms of deliveries. We had 93 babies. That translates into around at about 1,000 a year for newborn admissions at Hastings, and that's been consistent over the last couple of years. Full-time and part-time employees, 650. We had a number of HR briefings by the Oklahoma City area office and Cherokee Nation related to the announcement of a study for possible compacting, and the briefings were well attended, and the information was well received. I think folks are anxious to move along with the process. Don't hear any real opposition being voiced to the consideration of this transition, that folks are saying that this is something that would be beneficial to both the Cherokee Nation and Hastings, to have a unified healthcare system throughout the Cherokee Nation with Hastings as part of that. Collections, we're about $1 million over the first 4 months, year to date, over what we were at the same time last year. And last year was our best year that we've ever had at Hastings in terms of alternate resource collections. We had about 33.5 million in collections. The year before we had, I think it was about 28.6. So we had a very, very good year. And at this time, we are, as I said, about $1 million ahead of that pace for the first 4 months, and that translates, of course, into about $3 million if that rate were to hold for the rest of the year. We expect to have a pretty good year, and that's even with Medicare Part A collections down because of a problem with the NPI number and our name at Hastings. That is a holdover in the system from many years ago. It has nothing to do with any of the developments more recently. It's something that our intermediary Trailblazers is working on with CMS and trying to get that ironed out. And this is true. This problem is true for all of the facilities in the Indian Health Service, that there was a designation of a PHS Indian Hospital that was a holdover, and it didn't get translated when we applied for our new NPI numbers last year. And so it's just a matter of paperwork, apparently, that needs to be worked on. And we hope to see that resolved very soon. Our mail order pharmacy, we had a little bit of a glitch in the payment mechanism with the local post office, and that's being worked on, and I think that's being resolved. And so we should see, we had hoped to have this project up and running last month, but we've had to work out that problem and work through the delay. And we think that'll get resolved within the next month or so. Any questions anybody have?
Councilor Thornton?
Yeah, I know you and I was over there last Thursday, and we both think that Muskoge's clinic is fabulous.
Fabulous.
And probably the best in the nation as far as I could see. I've never seen anything like it. And I would like to know, do you really believe that facility will take pressure off of Hastings?
Well, we think so in some regards. We've done some studies on the patients who have addresses that fall within the Muskogee Clinic, the Three Rivers Clinic catchment area, and we estimate there's about 4,400 or so patients that if all of those were to transfer over and become primary care patients at Muskogee, that it would relieve anywhere between 16,000 and 20,000 visits. Now, we don't think everybody will immediately go and start being seen at Muskogee because of their relationships with our providers at Hastings that they've developed over the years. Now, we've had some of our providers, because of staffing issues, suggest to some of their patients that they may want to consider that, going over to Muskogee. So there appears to be some relief of those numbers. The 244,600 outpatient visits in 2007 at Hastings would be reduced maybe slightly. But then in the past, we've thought the same thing with the expansions at Salisaw and Stillwell. And in fact, instead of having reductions in numbers, we've actually seen increases in numbers of visits. So it's real hard to say. Our first guess, our first estimate is that it's going to transfer about anywhere, as I said, from 16,000 to 20,000 visits to Muskogee, but I think that we probably will see an offset with maybe people who otherwise would have been waiting in line, or maybe because of these high numbers of visits at Hastings in the past, that they felt that they would go elsewhere and would now start coming to Hastings from this area.
Are these visitors that you're talking about, the 4,400 over there, are they mostly all Cherokees? Are they all Cherokees?
Well, we have a mix, and I think in that area in Muskogee County, you would have a significant number of Muskogee Nation citizens also, Creek Nation citizens. And of course, you have the three tribal towns that are conterminous in terms of service area with the Muskogee Nation, and we have a number of folks from those three tribal towns as well. So I think probably the majority would be Cherokee, but there'd be a significant number who probably would also be Creek and the three tribal towns, and possibly even some of the other tribal groups.
Thank you.
Councilor Garvin?
Yes, thank you, Mr. Chairman. Couple of things. First, I want to say thank you to the council and the staff, and especially the council. They voted yes a lot of times to get this clinic going, and on the bonds and the lands and different things. It's just a great facility, and we're very, very thankful to each of you. And I thank Ed for his help, and I thank everyone for their attendance and the dedication. It was quite an event. But I have one question here. On these babies, 93 were delivered. Are you counting the one that's born out here on the highway?
We'll take credit for it.
Any more questions? Thank you, Mr. McLemore. Next, I believe Melissa Gower is out today, and I believe in her place is Dr. Graham.
Melissa is off seeing the babies in Dallas, so hopefully she's relaxing. Everybody should have received our report. Like Ed, I'll just kind of hit some highlights. We had our CAS survey, which is our EMS survey, at the end of January. It was a 2-day survey. Mr. Baker was there for the closing comments, and it went very well. They felt like we were in the top 1% of all ambulance services in the U.S. Thought we had improved from the previous survey 3 years ago, so we were very pleased with our staff and what they're doing there. Would like to invite everybody to it's going to be our second annual Cherokee Nation Cancer Summit, and we do it in partnership with OU. It's going to be in Tulsa, March the 6th and the 7th. Our first summit, we had about 150 or so people. We expect 200 to 300 people this year. So it's definitely growing. At Wilma P, we have hired a new medical director, Dr. Leslie Reptoy. I think she's going to be very good for this facility. We are still understaffed there. And Jody, I had some issues that Dr. Cobb brought up to me, and the first one we've addressed today with the patient that was going to be seen that needed a translator and had some other problems, and the other two we'll look into. At Salina Clinic, we're going to begin a remodeling there to actually be able to facilitate the care teams that we've talked about, and Dr. Cobb went with us in December, I believe it was, to Orlando, and it's a new kind of approach delivering patient-centered care, and we're going to have to do a little bit of just remodeling so that the care team will be very closely together. Mr. Garvin's already talked about Three Rivers. We will actually be seeing patients there on February 25th. So we have got lots of appointments. You asked Ed about patients coming. We are, because they're down a little bit, we've got some letters that are going out from Hastings to some of the patients living at Muskogee saying, would you consider transferring your primary care physician over to Muskogee? So I think we'll get a fair amount of patients from that. Will Rogers Health Center, we are seeing patients in that facility. It's going very well. We have interviewed a new physician, and we've interviewed 2 nurse practitioners, so we're in the process of trying to look at hiring some more staff there to help alleviate the 2 people that we have there. They need some help. Current staffing, we're at 850 employees. We have 129 vacancies. A lot of those are still Muskogee vacancies that as we get everybody in and we can start filling. We've actually selected for a large number of those positions. We've just been holding off until we move because the little clinic is busting at the seams right now. So we'll begin hiring the rest of those people now. If you look at our visits, we are up from last year, 27,394 for the month of January. Our revenue is down a little bit, but again, like Ed, we've been having some problems with the Medicaid billing number. We hope to get that fixed. It's something that is through Trailblazers that they have to fix. We're told that will be done, and we'll be caught up on that billing by March, so we should see our catch up by then and be back on track for billing. And I think everybody got the policy update that JT does for us every month, and hopefully everybody's had a chance to read through that. Some of the big highlights, the Chef Fund and Contract Health both saw a little bit of an increase, so hopefully we'll see an increase in those areas as well. And then also the Boys and Girls Club in Delaware County and Jay was funded at $438,000. And then the other big one for us was that the Special Diabetes Program was reauthorized through September 30th, 2009. So we're excited about that. Any questions, comments, concerns?
Madam Speaker.
Your remodeling at Salina, did you say, does that include plans for, any plans at all for a dental clinic?
Just say it. We are looking at that. I mean, that really is our next project, because we want to get the dental in, and so yes, it does. So the remodeling help plan the design for that. We're still waiting on our Muskogee money though, but we should have that this month.
Just a proverbial monthly request.
We'll
call you
hey,
Dawn.
look at Dawn. Yep, Dawn asked for years and years and years. And
This takes time.
it takes time.
Counselor Snell?
Okay.
We need a roof off about it, Jay Clinic.
Yes, we do. And we are, go ahead.
Where are we in the project?
We're supposed to be getting one. George Long, has been working on that project. And they were trying to decide, and forgive me because I don't remember all the technical stuff about roofing, whether to get this $150,000 roof or some other $50,000
We need a
roof.
better roof. We don't need a patch no more.
Yeah, no, they're going to actually re-roof the whole thing, and they were trying to decide what to, I don't know if they were looking at like a metal roofing versus just regular shingles. But we can have George Long call you. He's the one that's been working on it. Not my, but it's being worked on. I just don't know exactly what kind of roofing material they're going to use.
Counselor Buzzard, or did you defer?
I think he answered my question for me, but also,
See, Harley, you could probably advise them on what kind of roofing material to
Yeah.
get.
I understand, we talked to Todd Inlaw about it yesterday, and actually I think he may be handling the situation up there
Yeah.
instead of George Long, but either way, we could use them both, we could use both their help, but the other thing, and I'll just pass it on to you, Gloria, is the landscaping there at the J Clinic. I'd like to have some artwork put inside of there. We walked through there the other day, and it kind of makes the Muskogee Clinic, Don Garvin Clinic, also the Salina Clinic, has really nice Indian artwork in there. We don't have anything in J, and so our citizens, they feel like they're pretty much neglected for the last several years. So I'd like you to put some attention up there to the J Clinic now.
And
Now that we've got Don fixed up in Muskogee, so
we can move on.
we're going to move on, and we also want for a new clinic. I've been told that's for a new clinic, and that's what we really want there. So eventually, we'll be bugging the health department and also facilities manager about a new clinic there in Delaware County. So get ready for it.
I've seen you in once or twice already about that. So. We are gonna get the landscape done this spring. We had talked. What's his name? He works over in Natural Resources. Pat Wynn, about some kind of more traditional landscaping, and he gave us some things, and he said it was better to wait until spring to plant. We met with him in the fall of last year, and so we've got some ideas of things to plant. The art, the other good thing that we have found out is, if there is, with the law, with the art, that if there is, if there's a garage or something that doesn't need art, then that money can be designated for other facilities. So we're hoping to be able to get a little money from that and get some art.
Okay, well, I appreciate all that. Thank you.
Or we just take a piece from every clinic and
Counselor Calvin Watts?
Claremore Indian Hospital contract health dollars.
we are working on the outpatient dollars. Inpatient, we're going to probably need to wait until we look at a more comprehensive planning process at compacting.
So any time frame on that?
We're still waiting on area office.
Is there anything I can do to assist with that? I know that impacts Buell, England, and Brad Cobb as well. There's 3 of us that can go sit in somebody's office.
There's a lot of things we can go sit in their office for. I mean, truly. We've been having a lot of issues lately.
Well, I know that our citizens are effectively discriminated against because they're treated differently. And they are lacking in those services, particularly because they can't get the attention that other Cherokees get.
Yeah.
So, and I'm on year 4. How long did you take?
Long time.
Yeah.
It's longer than I've been here, probably.
We've covered J, Salina, and Claremore. Let's see if Counselor Soap needs some.
I was just going to make a recommendation that we set up all our initial visits through the Three Rivers Clinic, 'cause I think I got healed just walking into the place.
Pretty nice. I talked.
You can distribute them out after that, you know.
I told Dr. Cobb, he called me last night, and I was driving back from Warner, and I didn't tell him this, but I was driving back from Warner, and that clinic is so beautiful at night. It's just really amazing.
Are there any more questions? Thank you, Dr. Graham.
You're welcome.
Next is old business. There appears to be none, and after that is new business. Any new business? There is none. Any announcements? Next scheduled meeting is tentatively scheduled for March the 11th at 10 a.m. And I would ask that our next item of business is adjournment. Do I have a
So moved.
second? I have a first and a second. All those in favor?
Aye.
Any opposed?